Good afternoon and welcome to Cook County Health Department's School Health Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department, and I'm your host and moderator for these meetings. Welcome. I'm so glad everyone was able to make it. Let's get started as we have a full agenda. A few announcements before we get on to our presenters. And I see our presenters have joined. Thank you so much for taking the time out to come on. Our meeting objectives are to share updates, information, and resources to help the schools navigate school health issues, answer any frequently asked questions, and provide CCDPH contact information and resources. Our webinars are recorded. They're uploaded to CCDPH's website as well as our YouTube page. I'll provide all those links if you feel like you want to watch them back and get any information that you missed. Give me 1 second. I got it. Mute someone. And as I said, welcome. And here is our agenda for today. We have a couple announcements and resources, a quick communicable disease update, and we have a presenter from the Stop the Bleed program, as so many people have reached out and asked if I had any information on it, and I didn't, but I made it my mission to find out, and I'm so glad we have Amanda here to share that information with us. We also have some information from two of our substance abuse partners, Live for Lolly and Kenneth Young Center. Thank you so much for attending. A few announcements. We have heard from our School Health Advisory Committee as well as some other school partners that you guys are stressed out. I'm here with you. COVID-19 did a number on you. You're exhausted, you're tired. So I have secured for our January meeting a self-care and stress management professional who will talk to you and you only. So this will be for you. I see a couple sides, Patricia. Are you like, woo? Yes. So this will be for our staff. And so I'm excited to bring this to you. She is renowned within the community and she does a great amount of these presentations every week. So we'll bring that to you guys, as well as our advisory committee has explained that they need the information on Stop the Bleed as well as the substance abuse. So we are eager to listen to you guys and try to bring those resources that you've asked for in any way I can. And as we mentioned, our Health Advisory Council, we meet bi-monthly as needed, more if as needed, and we are in need of a couple more community members. We've had some people who have gone on to other positions or have left the field entirely, and we wish them well, but we also could use some more trusted members of the community to give us that voice. So the purpose of the School Health Advisory Committee is to advise CCDPH on subjects, on in-service subjects like we're having today, assisting with the planning of those meetings. They also keep CCDPH abreast of experiences and things that are happening within the school that we otherwise wouldn't know about without those trusted voices. So if you are interested, you're not shy about sharing your opinion, you have a little bit of time. I'm not asking for a lot of your time. I know we're all pulled and stretched thin. We only meet every other month and we try to come up with some ideas for our in-services, and they lend me their ear and tell me what's going on so that I can relay that back to our school leadership. Please email me if you'd like to join, and then I can give you more information on that. I'd appreciate it. Our in-home vaccination programs, as well as our destination vaccination program, which was a ride to those vaccination appointments, and our mobile vaccination clinics have all ended. As you know, the emergency order ended, so along with that is a lot of programs. However, stay tuned because I hear that we are in the planning stages of securing some partners who will still be able to provide those services to the community. So once I have all of that information, I will share hopefully at our next meeting so we can continue that service to the community. Here is information on Cook County Health Department's contact information. There's the general Cook County line. If you just have any questions and you're not sure who it goes to, you can email that line. If you need to contact communicable disease and you'd like to report your line list, report communicable diseases, have questions about metrics, here is their email address, as well as some other email addresses for Cook County Health Department. And here's just a list of Cook County Health Systems clinics. So if you are uninsured or underinsured, or you're looking for a new medical home, you can attend one of our clinics. You can call the number there to make an appointment. We don't turn anyone away. So you can attend any of those clinics. So Please pass the flyers out for anyone that you know who is in need of medical assistance, and they're pretty spread out throughout the city and the suburbs for your convenience. Here's just information on Cook County Health Department's events calendar. You can go to the website here to find out information that is going on. I'll give you a little bit more information about the event on the 17th a little later on, but we are having a event for teens on this coming Sunday. So I'll talk a little bit more about it later on in the announcements. If your school is interested in securing an EpiPen and albuterol prescription and standing order from Cook County Health Department, you can request that from me, kjones1 at cookcountyhhs.org. Please make sure those requests are typed and attached, no links, and it must be requested from a health professional who has been trained on the administration of medication. And this new document also must be accompanying, as we need to know who in your administration has been trained and how they were trained in the administration of medication, so we can keep that on file. If this is just a few resources, because some people have questions on how can I pay for those EpiPens or where can I get training for the asthma and allergy. So I just secured a few resources and added that to the slide. If your school does qualify for a new program through Asthma and Allergy Foundation called Rescue Illinois, that would allow your school to just automatically be opted in to get that asthma medication and the additional resources at no cost to you. So you're automatically opted in. You will get that information. So I had a few nurses reach out and say, I just got this box. I don't know where it came from. So if you have any questions or you're not even sure if you are eligible, you can contact Naomi Soto. Her information is here and she can talk to you about the program. If your school does not qualify, and there's some parameters, I'm not sure of those parameters where you wouldn't qualify, you can still secure that from Cook County Health Department. I know that there's a naloxone program similar to the EpiPen program that will be coming up soon. Any questions that you have regarding getting standing orders from that, you can contact Denise Holman. Her email address is here. She's our opioid health educator, as well as she can secure naloxone for schools. A few communications resources. This is just our campaign for boosting up. We want people to make sure that they are boosting up, and we're not just talking about your COVID vaccine. We want to make sure that you are up to date on all your vaccinations, including your flu vaccine, to keep you healthy. This is respiratory season, and I think everywhere you go, someone's sick. So we want to make sure that we're protecting ourselves and those around us. Here's some more information on that. And also, vaccine information. As I said before, all of those resources that we have for in-home vaccinations and transportation has ended, but we're going, as well as the school clinics, but we're going to see if we can partner with some organizations to still continue that. And I'll bring you some information as soon as I have that information. However, you may still be able to get free COVID tests for your home use at covidtest.gov. You can get up to 4 tests. And we are also still offering bulk tests for organizations through Cook County Health Department. So here's the request form, and you can still request some bulk tests for your school or your organization through that link, as well as PPEs. Before we had a presentation on mobile vaccinations for just general vaccinations for some schools who was having some issues getting that resource for their families. So these are still available, and you can click on any of these links to reach out to these organizations and then set up a mobile clinic for your school. It's advised that, let's say you want to set something up for summer before next school year, it's advised to contact them soon as their calendar fills up fairly quickly. And here's another resource for IDPH has a similar program for Wellness on Wheels. A couple resources I'm sticking here. Give me a second. There we go. As I mentioned, the teen event on December 17th, Cook County Health Department in partnership with NAMI Chicago is having a teen summit at Olympia Fields Park District. It is going to include resources from different partners. There's going to be a discussion about mental health and other ways to cope, as well as some resources, and I'll be there passing out resources and health education. So if you know some kids, know some teens, some teen groups who is interested in going, please come on out. There'll be hot chocolate and snacks and then other resources, and we hope that we can see you then. Our partner, one of our Cook County Health Department partners for an emergency preparedness sent me this link for a pediatric disaster preparedness seminar that's coming up. It's advised that different people in the community, such as health professionals, school administrators, attend. So here's the information on that, as well as she sent me information on a project from the American Red Cross. It's called the Pillowcase Project. I attached the link here. The Pillowcase Project is a preparedness education program for grades 3 to 5 that teaches students about personal and family preparedness and safety as far as local hazards and coping skills. So it sounds like a really great program. So I hope everyone can use this program, as well as just some resources for our mental health partners that we had attend last month. So feel free to reach out at any of these mental health resources, the 988 suicide hotline, the 211 hotline for general resources, and that is nationwide for those that aren't familiar, as well as our partner at Sertoma, some of their outreach and their programs as well. A little known resource for our park district, our forest preserve, that if you have a school group or any other organization that wants to go to the forest preserves for some of their events but don't have transportation, they provide free transportation at this following link. Just some more resources, and this is just one page with all of those links that I mentioned: how to get your COVID tests, find a vaccine location, get those antigen tests, and then find some PPE. I am going to toss it to Lex, if Lex is here, and she's going to give the communicable disease update. Lex is back, for those of you who have been with us from the beginning. She left us, but she couldn't stay away long. So Lex is back, and she is going to give our communicable disease update. Hi, Lex. Let me stop sharing so that you may share. And I can't find the stop share button. Give me 1 second.
Yeah, no worries.
There it goes.
All right, everybody bear with me a moment. I try to get everything up. All right, Kelly, are you guys seeing my presentation?
Not yet.
Yeah, okay. Everyone, I apologize. Here we go. Okay. All right, it is preparing my slides, it says.
I can see it.
Okay, thanks for bearing with me, everybody. Is it in presenter mode, or can you see full screen?
We can see the full screen.
Awesome. All right, thanks for bearing with me, everybody. All right, so some of you know me from earlier in the pandemic. I am part of the communicable disease data and surveillance department. So today I'm going to give you just an update on what's going on in terms of respiratory illnesses in the community. And then we also had a request to go over a little bit of GI information. So data updates, and then what we can do about what's going on. So first, COVID, it's winter. Just about cases are definitely rising, but I want to reassure you that it's nothing like what we saw 2 winters ago. It's the highest percent of hospital admissions for respiratory illnesses for the school age kids group, and it's the highest it's been so far this year. But in the youngest age group, the 0 to 4, like daycare age group or early kindergarten, kind of group, RSV is the biggest driver for respiratory illness this year. It's the second biggest for the regular school age group, 5 to 17, and it's definitely another weird year for RSV, but we think, fingers crossed, that we're peaking. So hopefully we're at the highest we're going to go this year. And then for flu's going up. Hospital admissions are up. We've recently seen a sharp increase in younger kids. ER visits are up, and the concentrations of flu virus that we see in wastewater is also going up. So that means flu's up, COVID's up, RSV is at a high level going into this holiday season. What can we do about that? It's the wash your hands approach. It's personal responsibility. You want to encourage everybody to protect themselves as well as possible. And I will pop any links you need in the chat from this, but I've got the IDPH infectious disease guidance for school nurses if you don't have that like plastered all over your walls. The biggest thing, as always, is to reinforce hand hygiene and respiratory etiquette. Kids should be coughing into their elbows, wearing masks when possible if they're under the weather. And something that's been working for schools recently that CDC's recommended is a hand washing schedule where like before lunch, you're providing hand sanitizer before kids eat to everybody or after lunch, and you're just rotating hand washing throughout the day, whether or not kids are going back and forth to the bathroom, if you've got a sink in the classroom, things like that. It might be a little difficult to enforce, but it's definitely had an impact on reducing illness in a couple of schools that have been trying it. So one way to reinforce hand hygiene, obviously encourage students and staff to stay home when they're sick. For COVID, the guidance is still to stay home for 5 days. And then if you're feeling well enough to return with a mask on for the next 5 days after that. For RSV, flu, any miscellaneous colds, stay home until fever free for 24 hours and then they can come back. Wearing a mask would be great in those situations if they're still feeling a little under the weather, even if they're fever free. And then optimize ventilation when possible. My husband's classroom has no windows, so he turns on the fume hood and runs a fan in there just to get that air turnover. Just little things like that. Staying up to date on the latest data and the trends could certainly help you out. That's why we talked about what was going on with all the respiratory stuff earlier. But we update that every single week on our website, so you can stay up to date. And then outbreaks. There's not a expressly defined number that's, the magical outbreak number. But if you're noticing a pattern, you think there might be a cluster, then, give us an email and we will walk through, what the situation is with you. Maybe it's time to deep clean that classroom. Maybe it's time to send a letter home and say there's been a lot of respiratory illness among fifth graders lately. A good guideline would be 20% of a defined group. So if you've got a classroom of 20 and you got 4 kids who are out with a fever and a cough in the past 7 days, all, getting sick within 7 days of each other, then might be time to act in that situation. Keep an eye on illness related absenteeism, and IDPH has like an example letter for you to send home if you guys don't have stuff within your health or your school system already for that. And I want to reassure you again, you're not crazy. Respiratory illnesses are on the rise right now, and it still looks different than it did before COVID-19. We're seeing lots of strep throat, way more than we used to. We're seeing way more RSV than we used to before the pandemic. So we've got still a little bit of time in this weird respiratory time that we're in right now. But those are the things we can do about respiratory. And luckily, a lot of those things apply for GI illness too. It is norovirus season. That's also the winter time. Parents may be calling it the stomach flu or something like that. When it comes to GI illnesses, hand sanitizer and alcohol wipes, that's not enough. They are tough bugs. Hand washing, we need that friction to destroy those germs. And then bleach-based cleaning in classrooms and surfaces is the key if you're dealing with a stomach flu situation in your schools. Just a reminder that kids are more likely than adults to have GI symptoms if they have a respiratory illness. So that's also something to consider if you've got some kids who are throwing up or having diarrhea. And then in general, kids shouldn't be in school within a day or two of their last incident of vomiting or diarrhea. If parents are like, my kid slept through the night, they didn't throw up, I'm going to send them to school in the morning, maybe it's time to send a reminder letter home. And then just as a joking reminder, but also a somewhat serious reminder, there is an ongoing salmonella outbreak tied to pre-cut cantaloupes. So just be careful with your melon. It's not something you need to talk to your schools about, but there's definitely an increase in GI illness right now. I will be in the chat answering any questions you have. And if you want me to put those links in the chat, let me know. But that is all I have to say. I'll pop it over back to you, Kelly.
Thanks, Lex. We missed you. If there are any questions for Lex, feel free to pop them in the chat or unmute yourself. As she stated, she will be on to answer any questions. I'll give it just maybe a minute and then we'll move on to our next presenter. Going once, Going twice. Okay. Thank you so much, Lex. And I'd like to welcome Amanda Oliver, who is the Trauma Injury Prevention and Community Education Coordinator with Loyola University Medical Center. And she's going to speak to us about the Stop the Bleed program. Thank you so much for taking the time. If you have slides, feel free to share. We welcome to
Wonderful.
hear anything you are going to talk to us about.
Alrighty, let me get this pulled up for y'all. Pull it over here, actually. So my name is Amanda Oliver. I am the Trauma Injury Prevention and Community Education Coordinator here at Loyola University Medical Center. I speak and come around on a multitude of different topics, anything you could think of with trauma injuries, such as falls, car accidents, bike accidents, you name it, I talk about it, and I try to help our community be able to prevent that. I heard that you guys were having a lot of asks about Stop the Bleed. So I wanted to be able to provide that for you today, and be able to hopefully give you guys some information. I'm going to share my whole screen, and it's saying that it needs permission. So I'm not sure. Let me pull it up a different way.
If it's still, I'll check
Kelly,
this.
I did email you the slides also. So let me try to pull
Okay. I don't
here.
have any blocks about sharing, but if you're having enough problems, I'll bring it up. Just let me know.
Yeah, I'm opening it up in OneDrive, so hopefully that'll work a little better. And then I got to come back to you. I'm sorry. Teams, I swear there's like some days that it works perfect for me and some days that it doesn't. So
It's my
really
mortal enemy.
depends on
Just
the
take your time.
organization we're working with. So, all
It's not
right.
just you. Teams is really fickle.
Let's see. All right. Do you guys see the presentation?
Not yet.
Nope. Okay. Try it one more time. And if not, I'll just talk through it and hopefully we can.
Okay, I'll start. Oh, there it goes.
Oh, okay. Now let me get to the present. All right. So we're here to talk about Stop the Bleed. If you don't know, I'm sure you guys do know, but Stop the Bleed is a national awareness campaign program that's intended to encourage bystanders to become trained and equipped and empowering to help during a bleeding emergency before professional help arrives. So this is the bystanders, the normal community members who are able to work and implement bleeding cessation techniques. And we teach this to almost everyone. So pretty much anyone who's interested in learning about this skill, where they will gain knowledge that has been, crafted and created by multitude of organizations from military all the way to trauma surgeons, to be able to help inform the public. Loyola ourselves have trained people from 9th grade and up. So I have come into high schools and been able to train through that mechanism. So we train a multitude of different individuals. So there's a couple different ways training can take place. We have our basic Stop the Bleed training program, which is your basic knowledge and training on pressure packing and tourniquets. We then do also offer instructor training, where if you fit all of our instructor criteria, we can get you trained to be able to go out and train others in the community and within your school associations, to be able to get people, knowledgeable about this. The formats kind of vary. We can do all in person, and there is a hybrid training format for the basic class. Instructor training is all in person, and I did put the times listed there. So it's typically an hour and a half per class, to be able to perform and get the information and then perform skills with your fellow instructor who's assisting during that period of time. So for a basic Stop the Bleed class, it does take us 2 to 3 months ahead of time to get that scheduled for us to be able to, learn about the size of the class that you want to have, make sure we have the proper amount of instructors and be able to get all of the items necessary. And we do ask that your class sizes are 10 individuals or more. In addition, we at Loyola do require the contact information for all attendees, just to be able to send them reminder emails and to follow up on their prerequisites if they do a hybrid class, because there are some things that would need to be completed online prior to coming to skills that day. And we don't want you as the nurses to be able to to have to take that on of following up and making sure that people are doing what they're supposed to do, I will take that on for you and be able to make sure that's communicated very broadly to your team. For instructor training, you do have to have taken the basic Stop the Bleed course, either the full in-person or the hybrid format. And then you will need to be in one of the categories that is listed on the Stop the Bleed website. Most commonly in schools, the people we train as instructors are certified health teachers, athletic trainers, RNs, PAs, police officers, and CPR instructors, along with nurse practitioners. So there are some specific qualifications to being an instructor. It can't just be anyone, unfortunately, but they primarily have to have some sort of medical knowledge and background about resuscitation. And I know this was a very quick overview, and I really want to allow time for questions because I want to know what you guys are looking for. So if you don't get to ask me questions today, all of my contact info is here to be able to email me either to set up a class or ask more questions about how we can get you a class going. So all of that's here, and I did share that, and I can resend it to be able to have that all provided to you all. But I would love to be able to take some questions about what you all are looking for and how else I can assist in helping you with understanding, learning, or getting Stop the Bleed rolling within your institutions.
Thanks, Amanda. I do have a question. I've had several school nurses ask about Stop the Bleed kits. Is
Mhm.
that something that accompanies the training?
No, so unfortunately, we do not have any funding at this time to be able to provide Stop the Bleed kits for institutions. I can provide you the links to be able to purchase them, and there used to be grants through the state of Illinois to be able to get those. So I would work with your administrations on potentially finding ways to fund that. A kit that goes on your walls, very similar to a AED, does cost a couple $100s to be able to purchase and be able to put up. There are personal Stop the Bleed kits that you may be able to have in your offices, and those cost around $45, but they are one-time use. So I could work with you to help try to find some ways to get that funded for you, but Loyola at this time does not have any funding to provide kits.
Okay, that's good to know. Are there any questions for Amanda? That was great information.
And I was trying to keep it quick because I know your meeting's only an hour, so I
No,
didn't
it's
want to
okay. It's okay. If it goes over, it's okay. It's great to have the information because it's hard to find these resources. So it is
Yeah. And
okay.
there was actually a bill passed in the Illinois General Assembly this year that is requiring all school boards to provide Stop the Bleed and bleeding cessation training to all school personnel every 2 years.
Mm,
So you might be hearing more about this as the school year starts for 2024 and 2025. Because that was passed this past June and was effective June 30th for the Illinois state law. So I'm not saying that you're the people who have to do that, but you're probably going to be hearing about it, and your school boards may be asking if you know how to get people trained. So I'm definitely a helpful conduit to help make that happen and be able to get that scheduled.
that's great information, and I'm sure the attendees appreciate hearing about that. So they're not scrambling when it comes up, and they know who they can contact. So I appreciate you letting us know. If there are any other questions for Amanda, feel free to unmute yourself. If not, Amanda did provide her contact information, and that slide will be shared probably on Monday when I have a chance to collate everything and send out to participants. Oh, is there a cost to train the staff?
Loyola University does not charge anything to come out and train. So as long as we can get everything figured out in advance, if you have a group larger than about 40 people that you want to get trained at one period of time, I do need to know that. So if you're looking to train your entire school system of staff members, there are methods to do that where we just do in-person skills training. We have you guys do some online training, and then we come in and kind of get you through expedited skills training. And I do offer instructor training times. I do those typically bi-monthly. So I host them at Loyola University Medical Center. Unless you have 10 or more at your institution, then I can come out and train you there. You would have to provide proof of your Stop the Bleed basic training being completed prior to becoming an instructor.
Sounds good. Any other questions? Those are fantastic questions. I don't see any more questions, but I want to thank you, Amanda, for taking the time out, and I'll be sure to share your information. I'm sure you'll be contacted quite frequently as the time goes on and it's required for this information. Thank you so much, Amanda. You have a good
Of
holiday.
course. You as well. And thank you all for all that you do for the students. Thank you.
Thank you. I was checking the attendance, and I'm not sure if Alex Matheson is on. I didn't see his name. If Alex, are you here? If Alex is not here, we will go on to Tammy, who has been waiting to present to us. I lost the screen that shows who's in attendance, so I'm just hoping that I can't see anything, but I'm just going to wing it. So Alex has not shown up on the chat, so we will just do a little rotating. If Alex comes later, we'll be sure to hear what Alex has to say with us. And I would like to welcome Tammy Crumlett, who's the manager of substance use recovery and prevention with Kenneth Young Center. Welcome, Tammy. I'm so glad you're able to join us.
Hello, thank you for having me. I do have a presentation, so I will share that. And can you see my slides?
It looks like it's trying to come up, not quite yet.
Okay. Know if it goes.
I can see them now, Tammy.
Oh, there it
Okay.
goes. Yep.
Perfect.
Thanks.
Okay.
Thanks, Lex.
So I wanted to talk about our services at Kenneth Young Center for substance use treatment. We have services for both adolescents and adults. And so I'm going to touch on both, but I know you guys are really more interested in the services for the younger ones. So this slide just talks a little bit about kind of the broad scope of what we offer at Kenneth Young Center. And so that, like, it's really broad. But the nice part about that is that as we're providing one service, we can really serve the entire family in a lot of different ways. I mean, everything from vocational to, older adult substance, mental health. So on the substance use side, we always start with an assessment and treatment plan. And then we offer individual substance use counseling, group substance use counseling, and we can do some case management. To touch on when to refer, like when it might be time to look for substance use treatment, if the person is, expressing that it's the only way that they know how to relax or how to fall asleep, if it's kind of their primary go-to way of coping with stress or difficult feelings, if there's a consistent increase in the amount or frequency of use, if you're starting to see changes in school performance, you're starting to see just changes in general, maybe changes in their friend group, or it's leading to conflict in the family. Um, a lot of time is spent with friends who are like the primary thing that they do is use drugs or alcohol. Activities that were once priorities are kind of being replaced, like they're dropping out of things that they used to enjoy. Um, there's a noticeable increase in depression, anxiety, maybe a first, an onset of psychosis, along with substance use. Um, if they're reporting that the urge to use is so strong that they have trouble thinking about anything else. If they're engaging in any like illegal or just unhealthy behaviors to obtain drugs or alcohol, so that could be like stealing from family members, those kinds of things. They've attempted to stop using or reduce their use and they have not been successful. Um, they have withdrawal symptoms if they try to stop. So they start feeling sick, maybe their mood changes, they feel anxious, irritable, have sleep problems if they try to stop using on their own. Or they experience an increase in tolerance where it takes more of the substance to achieve the desired effect. Um, so, in terms of our program, if they come through an assessment and they're recommended for services, we offer two levels of care. There's level one, which is outpatient, and that's up to 9 hours a week, which would typically be two groups per week. Or we offer level two services, which is 9+ hours per week. So typically that means that they'd be attending three groups per week. Um, Plus individual on other days to equal to total the 9 hours. Um, Typical length of stay is about 8 to 12 weeks. Um, we our groups incorporate an abstinence and harm reduction model. We don't specifically with the adolescents, we just kind of blend it because a lot of times adolescents are not ready for total abstinence. That's just not in the cards for them. Um, so groups meet at our Elk Grove office on Monday, Tuesday, Thursday, 5:30 to 8 p.m. Plus, again, some individual. We also offer family support groups so that the family is involved in the care. We also offer adult programs. Again, I'm not going to take too much time on that, but very similar Monday, Tuesday, Thursday, level one, level two. So if family members are having issues, we can serve family members also. Like if you're noticing parents who are having issues. Um, so again, I kind of referenced the harm reduction approach. So we acknowledge that an abstinence model might not be right for everybody. And so we don't want um, the um, the need to be abstinent or to even have that as a goal become a barrier to engaging in services. So we work with clients to set their own goals for what they want their use to look like in as safe a way as possible, and then we support them in reaching their own goals. Um, I kind of mentioned it a little bit. On the adult side, we do have an abstinence only group, and then we also have harm reduction groups, and those are kind of sorted out mostly to provide some safety for or security for people who have established their abstinence already, maybe at a higher level of care and want to continue it. Um, Trying to see. Okay. So we do group, individual, family sessions. We offer those with any clients, whether adults or adolescents. In our groups, we provide psychoeducation on a variety of topics, including healthy relationships, skill building to increase effective behaviors, physical wellness, and coping with urges and cravings. Um, and then the other piece of it, I'll kind of reference a little bit later, but we also have smart recovery on our non-clinical side, and that's offered for both adults and adolescents so that they can kind of follow up and maintain their recovery after completing the program. Our curriculum is a mindfulness-based sobriety, which was developed by Gateway Foundation. It incorporates concepts of acceptance and commitment therapy, motivational interviewing, and relapse prevention therapy. Um, as I mentioned before, we integrate. We have a lot of services within Kenneth Young Center. So, like I said, smart recovery. We have psychiatry so that they can do meds. Individual therapy, family therapy. We have groups that we offer. DBT groups are a little bit separate. So dialectical behavior therapy groups, vocational services. We have mentoring and parent support. And so again, all of that can kind of be integrated. In terms of payment options, we accept all Medicaid plans, which is kind of unusual. Sometimes there's kind of that patchwork quilt of, they'll take agencies will take one or two, but not all. So we also accept private insurance, typically Blue Cross Blue Shield. And then the others are we have to follow up on and see if we take other private insurances. We also have sliding scale fees. We have a township grant for young adults. which reduces the rate significantly if they don't fall into any of those other categories. And we also work with the Elk Grove Cares, which will pay for substance use treatment. Again, if none of those others are options, people do not need to be residents of Elk Grove or even, Cook County to qualify for Elk Grove Cares. They cover the whole state, and they've said that they would even cover someone from out of state if they could get here. We do accept some Medicare for some services, but not all, based on licensure of the clinician. Um, our service area for substance use services right now, there is no specific service area other than if they can get to us because all of our groups are in person. And then the best way to start the process is to call our intake department at 847-524-8800, extension 136. Usually that's where you start with getting the assessment scheduled. And I'm going to here. I'm going to stop screen sharing there.
That was fantastic information, Tammy. I appreciate it.
You're
You
welcome.
guys offer a very wide range of services to the community. Are there any questions for Tammy? I'll give it a few minutes. I know a lot of schools have reported an increase in substance use and abuse, and the students that they are coming in contact with aren't even hiding it anymore. They're doing it, in plain view or in the bathroom or something like that. So I know that a lot of schools can use this resource and pass it on to families as well. Well, it looks like you were so good at explaining it. They don't have any questions, but I'll be sure to share your slides with anyone who was not able to hear all the information or wasn't able to ask any questions at this time. And I appreciate you taking your time out. I know you were in the middle of doing something else today, so I'm so glad you were able to hop on and talk to us, Tammy. Thank you so much. You have
Thank
a good
you.
holiday. Thank you.
Bye-bye.
Bye. I'm going to check one more time to see if Alex from Live for Lolly is on. Maybe Alex had an emergency and wasn't able to join us. As we understand, as things happen, things are really busy right now. It's a busy time for everyone. So I do not see that Alex is on. So it looks like I can give you guys back a few more minutes unless there are any general questions for Lex, myself, Michelle, or any other of the staff that is on the call. I'll give you guys a minute or so and see if anyone has anything to add in the chat, or feel free to unmute. Otherwise, I will let you go early and you can enjoy this beautiful day. And I'm going to wish everyone a great holiday break. I know you're looking forward to it and counting down. Most schools, I think, are over next Friday is their last day, and then they are out of Dodge for a few weeks. So I want to wish you all the best and a safe holiday season. And it looks like there are no questions. Patricia, were you asking a question? You're muted. No. Thank you all. You take care, and I will send this information next week. Be well. Feel free to reach out if you have any other questions. Thanks to Lex for hopping on and giving us that update, and to Amanda and Tammy for taking the times out of their busy schedule to speak to us all. You all be well. Have a great day.
You too.
Bye.
Thank you.
Have a good
Thank
one.
you.